the minority.
Thank you, Mr. Speaker. And I want to thank Honorable Lillian Gogo.
Honorable Millie will always speak before you, whenever she wants.
Though that is discriminatory because the tallest man should be speaking before. But Mr. Speaker, having said that, I want to thank Honorable Lillian Gogo Honorable Dr. Lillian Gogo for bringing this before the House. And Mr. Speaker, I just want to say that under Article 43 of our Constitution, it provides for the right to health, to the highest attainable standard of healthcare, including reproductive healthcare. And legal framework, a new legal framework that replaces NHIF, and we passed 4 bills. And Mr. Speaker, I was in the House when those bills were being passed. I was especially opposed to certain parts of that bill, but that is now what under the bridge we have a new legal framework. Mr. Speaker, having listened even to the members, the honorable members as they move, Honorable Kimani Chungwa and even the Honorable Nyikala and the Chair of Health Committee, one of the things that I can indeed say is that the proof of the pudding is in the eating. So it is actually too early to even say, we would be cheating ourselves to say that here are the benefits. We don't know the benefit yet. If you are an excellent person at monitoring and evaluation, you cannot say within a month that we can see the benefits. So yes, we will probably see the benefits much later. However, we can see photos of people who are in hospitals who are struggling to access health care. Those with renal issues, those who are cancer patients. And Mr. Speaker, even though I know Honorable Ichungwa is actually castigating a lot of the members who he says are pushing propaganda, he's saying one. I don't know who that is, since I'm not too sure about, I'm not very keen on the politics of the mountain. But Mr. Speaker, what I want to say is that we need to acknowledge that there are very serious transition issues over this. And Mr. Speaker, if we lose a life, we can never regain it. I have a person who is very close to me who is undergoing cancer treatment right now and will not receive any treatment unless there's pre-authorization of payment. And Mr. Speaker, if me, I'm at the place where I am, maybe because they are able to do that, because we, for different factors we can. But the cries we are getting from our own constituencies, the cries we are getting from ordinary Kenyans is telling you that there's a huge problem with the transition. And this transition was not done efficiently. What I would want to encourage the chairman of the Committee of Health is, one, please do a kamkunji for members of parliament. I am a lawyer and I was here when this was passed. And a lot of us would want to sit here and pretend that we understand and know. Me, there are a lot of things I don't understand about this, and I passed this law here. What about ordinary Kenyans? Do an urgent kamkunji for members of parliament so they understand what this new system is all about. Number 2, we need to actually stop most of the things we are doing in this country so that members of the public understand and know how they can access health care. Because healthcare should be the most primary, right for everybody. Because if I'm already dead, how are you helping me? How will it be of benefit to me if I'm already dead? Even if you are to compensate, I will already be dead. So really, I think we need to take this issue more seriously than we are. Let us listen to the cries of Kenyans. If the health system is not working, a lot of the poor people can't access healthcare system, there is a problem. And Honorable Majority Leader, please listen. Please, the transition is not working well. Please take this and inform whoever needs to be informed that they need to take urgent action. The transition is not working well. Thank you, Lillian, for bringing this.
I would request we speak for not more than 3 minutes so that as many of us as possible contribute. The Honorable Omboko Milemba. I have not recognized you.
Thank you, Honorable Speaker. The issue concerning the new model of health provision in this country requires a consortium of all of us to deal with. It doesn't require even people to take podiums on one side and say that this is succeeding, while another team sits on the other side to say it's succeeding, because that will not help us. Another thing I want to say about this is that it doesn't even require statistics, quick statistics of we have treated several number of people, we have done this dialysis. I'm seated very close to the chairman, and he gave a number of such statistics. But even the leader of majority went ahead to give a lot of statistics. I was in a meeting over the weekend where the Minister for Health was called upon to speak on this. Honorable Speaker, she went straight into statistics the way I've seen this happen here, and she lost it. But later on, another speaker came, took her time or his time, and spoke about slowly. I was with the Honorable Maungu, and the second speaker really scored. So I really want to remove the first thing amongst members of parliament. There are those who are supporting, those who are not supporting, those who know, those who don't know. We don't know this thing properly. And we need to know it. If we don't know it properly, the local man will not know this thing. And therefore, because I know I have 3 minutes only, the first advisor is to go with Millie. Let's have a Kamkunji. But I had another one, that we need to invite the Minister of Health in this particular assembly so that he may explain to us what is happening outside there. Because unless the explanation comes out, it will be difficult. Honorable Speaker, the other challenge is the ownership of the whole setup. The Kenyans are not willing to own up this particular new model of funding. And the ownership can only be developed if, as the members of parliament will go outside there and explain. And also involve other parties. The chair here talked about is having people within this, and I've asked him informally here, that there are people around who can actually do the mean testing and actually register people. I'm telling you, Honorable Chair, that there are no people registering people in this scheme where I come from. And I have decided, since Sunday, I decided that I'm going to help. So for me, I'm going to go out flat to register all my constituents. But we have to involve other players. Let's not say that we have enough staff. Those CHPs, if they were trained to actually register people in this scheme, it would work. After all, they know everybody. They know the indigent. So even as we do the mean testing, they can actually add up to bring out the whole thing to work properly. And I think that's the direction we need to take with this thing. Otherwise, once the Kenyan person is complaining, we are not safe, even if we give whatever number of statistics. So for me, we need to own up this model, go and explain it, and use every other people within the circles to see how the model can work. Thank you, Honorable Speaker.
Honorable Karoli Omondi.
Thank you very much, Honorable Speaker, for the opportunity, and thanks, Honorable Lilian Gogo, for bringing this matter to the floor of the House. I agree with the other speakers that the transition has been very bad in this particular matter. I mean, there are already patients with chronic illnesses who are already being served under NHIF. And I wonder why they just never made the full smooth transition into SHA. Because they were already covered, they were already paying their premium, they were already receiving the services. But today they are being asked to register again. And I think this is where the biggest problem is. So we would like to hear from those responsible why there was no bulk transmission of existing members under the previous insurance scheme who had current premiums. And to make matters worse, even those who are enrolling today, they're having difficulties making the payments under the system. It is quite a challenge. You go to hospital, you enroll, you try to pay, you don't go through. But, Honorable Chair, I think the most critical thing is that this new scheme is grossly underfunded, and it will not work unless the issue of funding is addressed. The data I have, and Omboko Mulema, please forgive me for using some numbers, NHIF legacy debt is over 30 billion, which is not paid to service providers. How will you convince them to start accepting new patients under the new system, especially the private sector hospitals? The actuarial projections were that about 50 billion would be needed to start underwriting the 3 funds that we have created. Only 6 billion has been made available of the 50 billion that was required. And as the majority leader said, 14 million members have registered, but only 700,000 have paid. And I suspect these 700,000 are those who have been captured because of employment, not because of being self-employed. Yeah, because they are employed. So basically, we are looking at a new system that is grossly underfunded, projected to cost about 275 billion in the long run to make it fully functional, but is funded at 6 billion. And to make matters worse, we have committed 105 billion to buy a health management software system, information system, 105 billion, instead of committing the money to underfunding the insurance schemes under this scheme. So I think the biggest problem is the way this thing is being funded. And without sufficient funds, I can guarantee you it will fail. It will not work. Thank you, Honorable Speaker. I think we should have the Kamkunji so that we all get educated on this matter better. Thank you.
The Honorable Gadoni Wamuchomba.
Thank you, Mr. Speaker. I rise to thank my sister, the Honorable Dr. Lillian Gogo, for bringing this motion. I indeed had tried to bring the motion this morning, and I wrote to the Speaker, but I was informed that she had done that before me, so she was given the precedence, and I appreciate. Mr. Speaker, I personally went to various hospitals after I got a lot of calls from my voters on matters to do with the denial to access to health. I went to 2 hospitals that are mission run, 1 public referral hospital and 1 level 2 hospital. And I interacted with the patients, and I gathered there is a big problem. Whereas we sat here, like Majority Leader says, and we passed these laws, personally I did not pass them because I had issues with one of them. We must appreciate that you don't bring a new law and rush to implement the law without involving the stakeholders. When I went to those hospitals, Mr. Speaker, one of the hospitals told me and confessed to me that they are owed over 200 million by the former NHIF. And therefore they have a problem. I mean, how do you tell me to continue treating patients under a new program and you've not sorted my previous debts? And I know this is the problem. Most hospitals, by the way, the ones that are rejecting patients, they are rejecting patients because they feel that honestly, somebody needed to come out very clearly and tell them, we are migrating. But are we migrating with your debts? Are we migrating with your problems that we have not sorted under former NHIF? So this is the problem, Mr. Speaker. And let us not come here and read numbers. I appreciate the numbers that have been read out here by Majority Leader, numbers read out by our Health Chair Committee, Dr. Robert Pukose. But numbers is not what our people are waiting for. From this debate, they're waiting to hear how are they going to be treated tomorrow in hospitals, Mr. Speaker. Mr. Speaker, when I went to one of the hospitals, I found a patient who was withdrawn from the ward, only to go and queue out for dialysis at 6 a.m. from the ward. And I visited that hospital at 4 p.m. here in Nairobi. And I found that patient in the queues waiting. And he told me the reason why he has been waiting from 6 a.m. to 4 p.m. in the day. It is because, Mr. Speaker, the messages that were supposed to be sent from SHA so that he can be embodied for services were not being accepted. We must tell it as it is. This new program is a total confusion, it's a total mess. Our people don't know what to do, and we must go back to the drawing board. But for now, let us withdraw these processes and go back to the original program until we are right. That SHA, SHI, DA.
Honorable Sabina Chege.